Our final speaker of the conference is Patrick Tolan. Most of you know Patrick. He is the director of Youth Next, which is our Center for Positive Youth Development at the University of Virginia. And he's going to talk about positive youth development and physical health and well-being.
Thank you, Art. And thank you all for staying for the end of this. First of all, before I do start, I want to thank Art for really organizing and chairing a great meeting and getting all these people together to bring this diverse group of people together. That's a lot of work. And also Ellen and Crystal for their work and making sure that occurs. They seem to be tireless, and I've really tested that question out, so I know. So I'm going to try and talk a little bit in a wrap-up kind of way about trying to integrate positive youth development, which is this idea of trying to understand how things go well and looking at capability among children, families, and schools, rather than the focus on how do things go problematically. Oops. Okay. So first I want to start with this idea, is that this is a complex problem, we all know. And as Mark Twain said well over 100 years ago, we can find simple solutions for these complex problems. They just happen to be wrong. And so we're going to have to stop and, as you were saying, take a bite of the apple. Another way of thinking about that is to see all the different versions of the way people are looking at this and try to think about how this might be put into play. There were a lot of lessons learned from this meeting, and I want to try and go through some of those quickly. First is this fact that 70% of schools do not have a recess. So here we have a time that we would have kids actually be engaged in physical activity, as well as what we've been talking about around this idea of a stop and take a break from sitting and learning and to be able to be fresh and come back at it. So where are the priorities if we're assuming that we can do without this kind of time for kids? And how do we think about that? The second takeaway, which I think may be the most powerful one for me, is the early and often kind of idea. There's a lot of work that needs to be done early and often in helping to form habits. I mentioned my view that this is how we deal with eating is probably the most dramatic cultural change we've had in the last 25, 30 years. And how do we go about creating guidelines and understanding of that so parents can know how to raise children, and more importantly, people can learn as how to manage health and well-being as an important part of their life. And that goes back to the priorities. If schools are about raising good citizens, understanding your health and your well-being and how to manage that is a critical part of our society, economically as well as in terms of the overall function. That there are multiple opportunities. We heard over and over again about different things people were doing and the different ways that these we can affect both the eating side of health and the physical activity side of health, and the multiple ways in which that can be done. And then probably the best thing to do is to start to build in opportunities rather than trying to get people to stop doing certain things or to give them a lot of lectures or PSAs about what they should be doing. But to build in opportunities, so like going into a cafeteria and making the selection of healthy food a whole lot easier than the not healthy food. Same with thinking about how we might deal with supermarkets or helping parents think about meals, if they are going to be doing quick snacks, how they can have healthy quick snacks rather than those are harder to get. Okay, we're dead in the water. There we are. Okay. Also that these built-in opportunities, these nudges, these opportunities to make good choices are healthcare, they're in the healthcare system. The extent to which pediatricians might start to, and healthcare nurses might start to talk, talking to the lead about home visiting, might start to talk about the issue of learning to understand your body, and when you're full is a different kind of parenting practice than clearing your plate because there are children in other parts of the country that are, world that are starving, which was the old approach. And also with education and in the community, and particularly some of the physical activities, the idea that after school fits in very nice with this issue of wanting kids to be supervised. Many families have parents who are working, so the kids need to be in safe, supervised places after school. So there's a way to meet a lot of need. It's not necessarily a luxury as much as it is an opportunity, again, for people to be able, and for kids to be educated and to have healthy time where they're healthy and safe. And then this idea of messaging, that came up regularly. That messaging about health and about nutrition and about managing yourself, and whether it's calming yourself down before you start to work, or whether it's stopping eating when you're full, or eating certain colors of foods at certain amounts. These are all messages that if we put those out there, they start to become ways in which they can be incorporated into children's lives and become their habits. And we know that the long-term consequences for health and healthcare costs are huge if we can get these things to shift. But there's a lot of challenges in these kinds of things. First of all, I didn't hear clear goals that we had for health and for dietary activity. I heard a lot of them, and I didn't hear clear ones that I could grasp, and it may be that among different groups here there are. But that idea that we really have a sense of what is it we want people to do. There was something about reducing the number of calories per day the average child takes in. That's about as close as I could hear. But how do we turn those into mantras, meaning things that we repeat over and over and over again, so they become the kind of thing that has, across the society, people are talking about and understanding what you mean by that. How do we get it right versus get it done? And that's often a common challenge. We talk, people in my area, our job often is to talk about here's how things could be done, here's what the research says. But then when I try to talk to my colleagues who are in practice, they say, well, we've got to get this done, and there's no money, or there's very little money, or we have to implement it within the current system, or as we heard over and over again, we can't do that in the schools because that might take away from instructional time. And instructional time is seen as the only way to improve test grades, so we have to keep pushing that. So how do you get things right, but also get them done? Also that each agency, whether you want to talk about school or community agency or whatever, they have needs that are driving a lot of their engagement, a lot of their work, and you can see this across collaborations of any sort. There's always this contention between what the agency's needs are and the role that they're supposed to have in a collaboration, and who controls the collaboration. So I've been meeting, where the police won't come to the meeting if child welfare is calling it, the child welfare won't come if juvenile court's calling it because they want to know who's who's deciding things. And just getting those kinds of things worked out can often make it very hard, even if you've got clear goals, to get things done. People will have very different ideas about the role of evaluation. You're talking about the baseline there. What does that mean? How much can we really give report cards about particular communities and particular schools and really make use of that information? How do you present that? How do you make that useful? Also, that as we come up with ideas about what could work, the usability of these. Could these be done? We spent a lot of time talking about that today. And in the area of prevention that I've worked in, we're about 25 years into identifying about 120 some programs that can make a difference in preventing problems of youth development. So that's a large roster, but the usability of many of those programs is very questionable. So even though they can work, it's not clear that they could work if implemented. And then also, what do you mean by it works? What that means. Everybody loves evidence-based practice now. It's very good to hear after 20 years. The problem is they all mean different things, and a lot of times it means my program. And to put it into one word, I think the issue of the day is how do we have successful co-opetition? Because there is always competition going on among those engaged in this, but there's also a need to cooperate. And if we can figure out what this word means and how to do it, that might be our best possibility. I'm going to skip most of this, but I wanted to show this real quickly. If you think about what do you mean by does it work, there are different levels of proof. And I'm not talking about research design here. I'm talking about really kind of what quality of information you have. And as someone outside of the area of physical activity and nutrition and listening, what I heard really is that there's a lot of inferences from descriptive studies. That means people have done something and showed that this relates to this statistically, and we can believe it. It's not just chance. It's not just what I want to believe. But that's different than changing that would make a difference. And I think the question is, and I've been talking with people about this during the last bit, can you get to where you start to have a roster of programs and activities that we know if you do that, it's likely it's going to affect nutrition, health, and well-being. And how to start to create that kind of roster, just as occurs in a lot of other areas of health, starting to occur in education, starting to occur in justice, and as I said, it's been developed fairly well in drug prevention and mental health promotion areas and treatment. So And then the next level is this summarizing of best practices, but it's really hard to get there unless you get this roster. And so I really would urge the scientists in this area and the advocates in this area who are trying to get funding for work, and I know what the funding for research is these days, but trying to create a roster of programs that demonstrate practices that can work. And then eventually get up to these higher levels where you start to be able to say, okay, here's practices, here's how you can do that, and they can work. That said, I want people to realize models are not the same as actions. This is one of my favorite quotes. It's one thing to call for, as we preachers, as we're all preaching these last 2 days, do as the prophet Amos is, which is let justice roll down like mighty waters. And it's another thing to have to figure out the irrigation system and how we're going to make that happen. And much of the people here who are in the business of figuring out that irrigation system recognize that it's more than just saying we should have health, we should be thinking about kids' nutrition. These things are important. Its question is, how do we get this done? How do we put that in place? And I recognize that that's different than having some good, promising research and programs. But here's all the opportunities, and this is probably more, but I'm going to run out of time. I'm not even going to go through them. And I just wanted to lay out those that I thought were probably major ones that I heard over the last 2 or 3 days. But there's at least some research to suggest, either directly from within this field or from that principles that probably aren't field specific, in other words, aren't specific to health and well-being, they aren't specific to nutrition, should make a difference, could be targets for interventions, and could be places in which there could be demonstrations of work on this area will make a difference. And could start to move us forward, particularly if you sort of go through the first list, and then I'll just mention a couple over the other list, which start to be more about how do you change the nature of the way interventions occur. And that first one is the microenvironments. I heard this very interesting idea of refitting schools, remodeling schools so that how children think about eating and are engaged in eating and how they're engaged in physical health and physical activity is environmentally shifted. And it's a microenvironment. We're not talking about changing the whole policy world. We're talking about changing the way a school organizes its cafeteria, for example, or how much you make it easy to walk to places rather than to get on elevators and escalators. Also getting down to this empirically based toolbox. How do you create a toolbox that practitioners can rely on? I was just involved in a project here, and we were trying to come up with a list of drug prevention studies that people could rely on, so we could say, if you're doing these programs, that's good. If you aren't, we don't know what you're doing is good. And it was very hard to come up with a list that was very reliable. And then there were a lot of questions about the list. But we were able to come up with a list, again, of over 100-some programs that people could be using. And that becomes a pretty good toolbox for people if you have that many choices about which tool you're going to use. How can we get to that? And then the last one is this issue of how we engage business, and how we engage business not in terms of trying to necessarily keep them from doing their business, but how do we make it profitable, how do we make it interesting. The difference in when I walk into a supermarket now and even 5 years ago, the extent to which the marketing to me is about this food is healthy, this food is natural, this food is local, this food is good for you, and how do we start to create those market forces that support this. And that'll go back to the original thing we started talking about, which was some of the insurance changes under the Affordable Care Act and what are the incentives that can be there. So that said, I think for what I want to suggest out of this conference is that we continue to think about trying to bring facts to this discussion, and to test those beliefs that we have, whether they're scientific, religious, or social, or political, and to see which things really make a difference, so that when we do come to meet with legislators, we have some facts to give them, and it's a little harder for those to be ignored than the opinions we might bring. The TJ, of course, is I got all the way through my talk about quoting Thomas Jefferson, and it's a requirement at some point that I mention him, so there. And again, just to reiterate and to thank you all for helping make this conference work in this area, which is the idea that ultimately the best policy is going to come out of scientific study and information that brings facts that really help us understand how this cute little baby turns into this very capable young man, and how along the way kids are healthy and able to succeed. So thank you.